Good evening, everyone, and thank you for being here tonight. For those visiting outside of South San Francisco, welcome to South San Francisco. We're glad to have you. I'm Mayor Eddie Flores, and it is an honor to host this important town hall here at our Library and Parks and Rec Center. A space really built for community, for learning, and for connection. I'd like to begin by thanking our wonderful city staff and everyone really who has worked tirelessly to make this event possible tonight. Everyone from our custodial staff and our city staff, our parks and library staff, to our county staff members who have helped shape this and bring this together. Let's give them a warm hand to thank them for putting this together. I'd also like to acknowledge some special guests joining us this evening, starting off with my colleagues here in the South San Francisco City Council. I have with me Councilmember James Coleman in the back. Welcome. Councilmember Mark Nogales. Councilmember Flor Nicholas. We also have Mayor from the City of Pacifica, Sue Beckmeyer. Councilmember Greg Wright from the City of Pacifica. Former San Mateo County Board of Education trustee, Hector Camacho. We have our wonderful, amazing city manager, Sharon Reynolds, here. Our Park and Recreation Director, Greg Midiotti. Our Library Director, Valerie Summer. And our South San Francisco Police Lieutenant, Amy Sarniotti. Welcome. And of course, we have a few of our city's commissioners and board members, so welcome you all this evening. Tonight, we're especially honored to welcome two extraordinary leaders whose commitment to equity and family well-being is really shaping the future of San Mateo County. First, Supervisor Jackie Speier, representing District 1, and a proud South San Francisco native. Jackie's legacy, as we all know, of public service, spans over 4 decades. From her early days on the San Mateo County Board of Supervisors to 18 years in the California legislature and nearly 15 years in the United States Congress. She's been a fearless champion for affordable housing, universal child care, suicide prevention, and eliminating child poverty. Her tenacity and courage have earned her national recognition, and we're proud to have a library room right here in this very building named in her honor, a space she helped fund and celebrated with us at the ribbon cutting. We're also thrilled to welcome Supervisor Lisa Gauthier, representing District 4 on the San Mateo County Board of Supervisors. Raised in East Palo Alto, Lisa began her public service journey in 2012, inspired by her daughter to make a difference. She served as mayor of East Palo Alto 3 times, leading the city through the pandemic and major storms, and achieving historic milestones like 0 homicides in 2023. She's also a regional leader in equity and inclusion, having previously served as Senior Vice President of Inclusion and Belonging with the Silicon Valley Leadership Group. Her focus on public safety, affordable housing, healthcare, and education reflects a deep commitment to uplifting every family in our county. So please also help me welcome Supervisor Lisa Gauthier. Now quickly, since I see so many of our residents here in South San Francisco, let me share a quick glance of what childcare really means here in South San Francisco. For families here in South City and across San Mateo County, the reality of childcare is a significant burden. You know, the expense for just one child can easily reach from $2,000 to $3,000 a month, placing an immense pressure on household budgets. And beyond the financial strain, the process of finding providers, this only continues to face long wait lists and limited options, and it is very deeply stressful for many of our families. Here in South City, we've long recognized that childcare is not a luxury. It really is a necessity. That's why we've taken bold steps to support families and build a sustainable childcare ecosystem. We've developed a child care master plan that jointly with my colleagues on council have helped guided our strategies and strengthened the employment pipeline for child care professionals. We're one of the first cities in San Mateo County to implement a child care impact fee, requiring developers to contribute to the construction of new preschool spaces. We operate 3 licensed preschools serving over 135 families, with a new center currently in design for the Westboro neighborhood, thanks to the leadership of my colleague on council, Councilmember Mark Nogales. We're the largest school-age childcare provider in the city, supporting nearly 700 young scholars across 6 campuses. All of these programs are subsidized by the city to keep fees affordable and accessible. And tonight, in partnership with our supervisors, we're even providing free childcare so parents can fully participate in this town hall tonight. But most importantly, tonight really is about listening. Whether you're managing high cost, stuck on a wait list, have left the workforce to care for your children, or are satisfied with your current care, we want to hear from you. And your experiences are vital and your voices are invaluable. And that's why we have this mic right here, because it's going to be available for many of you to come up to it. This is the first of 3 town halls across San Mateo, and Supervisor Speier and Supervisor Gauthier. We're all here really to learn directly from all of you and the experiences. Together we can work toward a future where childcare is accessible, it's affordable, and equitable for every family. So thank you for being here all tonight. And thank you for sharing your stories and your challenges that we'll be hearing. And also for sharing your hopes. So let's get started. Now without further ado, I will turn it over to our special guests. Please welcome once again Supervisor Jackie Speier and Supervisor Lisa Gauthier, and let's get the night started. Thank you.
Thank you, Mayor Flores. A special thanks to the South San Francisco family for opening once again this beautiful facility and for paying for the child care that those who are the families here are going to have the benefit of. Please, we have light dinner here. Don't hesitate to get up and get something to eat. I want to thank Emma Gonzalez from the County of San Mateo, who has arranged for Spanish and Mandarin translation, and to Ron Obregon and Martin Vera for the Spanish translation, and Andrew Ning and Bonnie Chan for the Mandarin translation. Just a reminder, it's important that you pick up your child or children immediately after the event. We are going to be streaming this on Facebook and videotaping it as well. So if you have friends or family that you want to share it with, you'll be able to do so. So why are we here? Well, first of all, you're looking at 2 grandmothers, and we're seeing firsthand how difficult it is for our children to raise their children in San Mateo County. We have a workforce crisis here in San Mateo County that starts in the crib. We expect our workers to work as if they don't have children, and parents to raise their children as if they don't have jobs. It doesn't make any sense. It doesn't make any financial sense either. And that's why we see our children, our actually birth rate in San Mateo County plummeting, and families leaving San Mateo County. So we are committed to making some bold changes as it relates to childcare here in San Mateo County. Kudos to South San Francisco for doing all that they're doing. We have to do this together. But we do care deeply about this. I was a single mom for 8 years, raising a 5.5-year-old and a newborn. I know what it was like. And I know that we're going to hear from my colleague, Supervisor Gauthier, about how she is recognizing it. I have 2 children right now, one of whom has 1 daughter and a new son on the way. And they are both out of work this week because the young one came home with what they thought was hand, foot, and mouth disease. Turned out it wasn't. But as a result, they had to make other changes. So 81% of the parents in San Mateo County say that they have problems working and having childcare accessible. And some 46% have left the workforce. So businesses in San Mateo County have seen an $80 million cost associated with the fact that their workers have problems making childcare work. So we've got some solutions that we're going to present to the Board of Supervisors as a result of these town halls. The Jackie Speier Foundation actually commissioned the first study that we will be presenting to the Board of Supervisors in 2 weeks. And all of that information about what's happened here in San Mateo County is going to be available to all of you. So with that, let me turn over the mic to my colleague, Lisa Gauthier.
Thank you so much. Thank you for that. Thank you for being here. This is so important to me. I am a mother of 3 young adults. My daughter we have one grandson who's the apple of my eye. He was born in 2020. And I know how important it is. My daughter, who has a master's degree, and she's a licensed marriage and family therapist, can't live on her own and have daycare at the same time. So they live with me. Now, I'm not mad about that because I get to see my grandson every day. But I know as a mom what it would mean for her to have her own space. You know, when I think about Camden started at a home daycare where he was learning Spanish. And he outgrew that, and we put him into another daycare. It was very expensive. So I know firsthand, if she didn't live with me, would she be able to work and pay for daycare? So the cost of daycare is a barrier to participating in our environment, in the business community. Many family members are staying at home so that they can take care of their children for at least the first 5 years, which is not fair. You know, this week alone, my grandson started TK. And so just yesterday I got to walk him to school and show him to his classroom. And I'm very fortunate that we had a program that he can go to. It's the primary school. It's the last year of the primary school. But those opportunities are not available to everyone. And when we think about equity and inclusion and the possibility for our young people, we need more spaces. We need it to be affordable so that families can work and thrive and survive here. We know that for young kids, their brains are developing in those first 3, 4, 5 years. So giving them the space and the opportunity to learn and grow is very important. We're here to learn from you. I know firsthand what we're experiencing, and I'm hearing from others, but your stories are very valuable to us tonight. So thank you for coming, and we're looking forward to hearing.
Okay, so we're going to try an experiment now. If you have your phone, you can scan the QR code up here. And then you should go to menti.com and type in the user code at the top of the screen, 9234-8303. And then we're going to ask a couple of quick questions.
See the thumbs up on the I see that. So we're getting people signed up.
Okay, are we all good?
If you need more time, raise your hand.
Challenged adults.
Are you on the Wi-Fi? Do you need Wi-Fi information? You still see phones up, taking pictures of the QR code.
What's the Wi-Fi?
What's the Wi-Fi?
It's free. It's library.
Anybody come up and share the Wi-Fi?
Probably the library.
SSF Public.
SSF Public.
Or menti.com. Just go to menti.com if you don't want to scan it. Just take the straight there.
It's low. This has so many people. No internet? Okay.
All right, so we're gonna start here. Okay, first question is, what role are you? Are you a parent? or provider, or other?
It's like a race.
A lot of others. Okay. Next question is, in one word, describe childcare.
One word. Describe childcare.
Expensive. Quality, essential, complicated, needed, imperative, trust.
Expensive is not moving.
Expensive and essential says it all in many respects. Necessary, important. Okay, the third question. If you have a child under 2, about how much are you paying for childcare per month?
I'm afraid to see this.
Okay, next. If you have a child over 2, about how much are you paying for childcare per month? Over $4,000. Okay, I think those are all our questions, correct?
Yes.
Okay, so now the mic is yours, and we're here to listen. So who would like to be first?
Thank you. We need that one person to get to the mic so we can get started, you know?
Good evening, everybody. This way?
No, the mic's on the other side.
Right here?
No, on the other side of the table.
Here?
No, over here, where the microphone is.
Oh, my God. It's been a long day. Okay. Can you hear me? Yes. Okay. Well, good evening, supervisors.
Right into the mic.
Testing, 1, 2, 3. Hello? Hello?
Guys.
Is it on? Is there anywhere to? It's not on. No, it's not. It's right here. Try it now. Here we go.
Okay. Well, good evening, everybody. Supervisors, county staff, and community partners. My name is Haley Village, CEO, Director of It Takes a Village, Children and Family Services, and I'm coming today to speak to you as a family childcare educator, a nonprofit leader, and an advocate for thousands of providers who are at the backbone of our childcare system, who remain overlooked, underfunded, and undervalued. We are in a childcare crisis, but let's be honest, this crisis didn't start yesterday. It's a result of decades of underinvestment in childcare, in family childcare, a legacy profession led primarily by women of color, deeply rooted in our communities. Family childcare educators are licensed, regulated, and doing the work. Yet we are consistently left out of decision-making spaces. Our data is used to secure funding, but we seldomly reap the benefits. We are educators, not babysitters. We are small business owners. We are regulated by the community care licensing, operating in one of the most expensive regions in the country. And we do it all, often without access to medical, dental, retirement, or basic financial support. During the pandemic, family childcare programs were the only programs allowed to stay open. Let me repeat that. During the pandemic, family childcare programs were the only childcare programs allowed to be open. We were the invisible essential workers behind the essential workforce. We kept parents in jobs, children in care, and communities afloat. And now, just a few years later, we're closing our doors, impacted by rising costs, lack of direct investment, and the rollout of the UPK mixed delivery systems that siphon our children away from the family childcare spaces without support for the providers who remain there. Family childcare is not just care, it's a culture. Families choose us because we reflect their lives. We speak their language. We cook home-cooked meals. We offer flexible hours and cultural affirming care. Family childcare is not an option, it's a vital choice for working families. Let me be clear. When our rent is over $4,500 a month, when tuition barely covers staff wages, food, insurance, workers' compensation, supplies, when private pay families are our only source of income stream, there's no equity there, it's survival. We need San Mateo County to help us to do better. We need to invest in family childcare educators as part of the childcare infrastructure. We need to launch home ownership initiatives to stabilize providers. Some of us have been faced to move 4 and 5 times in 10, 20 years. We need to help cover sustainability for program fees so we can remain licensed and compliant. We need a discretionary fund to help support in emergencies with repairs and supplies. We need help for lobbying a ratio reform. We need recognizing that family childcare is an essential infrastructure and funding us accordingly with access to benefits, retirement, and businesses and support. Other states are showing us that it's possible. Vermont passed the Act 76, investing $125 million annual to childcare, raising reimbursement rates and paying providers based on enrollment. New Mexico, Illinois, and Washington State are all doing their part. Family childcare educators have always been there for our children. It's time for San Mateo County to be there for us. We're not asking for charity, we're asking for justice, we're asking for recognition, for a seat at the table that we helped build. Thank you.
Go ahead, Mark.
Hi, I'm the only parent on the city council in South San Francisco, so I can speak to this issue. I have 2 young kids. Our city subsidizes our childcare after school, and my 2 kids, when they were in the program, I only paid $800 a month. $800 a month. That's an absolute steal, because this city believes in providing childcare. So I would ask that the cities that you represent to go back to those councils and ask them to step up, to look at what can you do more in terms of providing childcare. If it's providing childcare impact fees, if it's subsidizing childcare, that's really, really important. The other thing that's really important is infrastructure. We're building a new childcare center in my district up in Westboro. We're gonna have like maybe 80 to 100 kids. But our wait list right now, if you look at it, depending who you talk to, when my 2 kids were on the wait list, it took about 4 or 5 years. And a lot of times, those parents can't wait, so they have to go to childcare that's really, really expensive. So I think there's kind of a different prong of approach here. You have to provide the infrastructure, and you have to provide the funds to build that, and then you also have to hire more childcare providers and get them in the pipeline. Because if you build the infrastructure, you have to hire individuals who are going to be working there. I think that's something you can take a look at.
Councilman, can you tell us how much South San Francisco commits to childcare per year and how much that impact fee for new construction?
Yeah, I mean, there's a formula for childcare impact fees. The reason why we can build the childcare center in Westboro is there was one R&D development that came into South San Francisco that brought in about $9 million in childcare impact fees. I'm sorry, 11 million to build a new childcare center. So we're taking that money, and this council has a forward thinking and saying we want to build more childcare, so we're going to use that money to build the space. So I think it can be done if we have the leadership amongst our city councils along the peninsula.
And then in terms of the after-school care, how are you funding that?
Where's Sharon? Sharon, you want to come up here?
Hello, Sharon Reynolds, City Manager. We just put those numbers together for the county survey, and I want to say it's about $3 million. But of that, there's a significant amount of grant funding. So we get the ELOP funding, we get some money for the big lift. But I think our child care budget, I'm looking back here, Laura just put those numbers together. Laura's going to look up, but it's about $3 million.
A year.
Yeah, but again, some of, we charge fees, some of it's free, and some of it's grant funded.
Thank you, Madam City Manager. Just to help you appreciate some of the things we're looking at. If, like Measure K, which was passed by the voters some time ago, generates about $130 million a year, which we have used for any number of different programs, a lot of housing, a lot of programs around the homes. If we did a half-cent sales tax for childcare, it would generate $125 million a year that could be spent on providing a dividend to parents who have children. That would be a form of universal child care. The county is also looking at creating, and Linda Wolin, I think, is here, I think I saw her, a portal, which would have to come before the Board of Supervisors, but all parents could go to this portal and determine where there are child care providers in their zip code, if they had openings, and how much it costs, so that we can streamline that process and make it more user-friendly for families. So there's some of the ideas that we have that we're thinking about.
Anyone else? And Haley, we're going to continue the conversation because you are important, and we want to make sure that you're heard and you have a seat in this program as well. We'd love to hear from others. Come on up to the mic. Don't be shy.
Hi there. My name is Rayhan Uyghur. I started as a parent and then opened a preschool. I'm a family nurse practitioner. After 10 years of working at the Stanford Emergency Room and then 10 years at the San Mateo County Medical Center, I got married and had a child. And I worked weekends. I worked 7 in the morning. After I exhausted parents and neighbors and best friends, desperation, we started looking for other options for me to do as a career. So I decided I would open a laser hair removal with like my NP license, because in the middle of my shift with my stethoscope around my neck, I'd have to ask a friend, can you watch my chemo? Can you watch my blood? I'd have to run to the car, get my child from one school, drop her off to the other school because it was half day, and have, within that half an hour, come back, park my car, and make sure that my patients were safe. It just wasn't. So anyway, I thought if I opened my own business, I could do my own hours and I can have my child with me. But in the meantime, we saw this building in the Shriner building. My husband's a contractor. And he said, Rayhan, this is ridiculous. We can't find a spot for our child. Why don't we just build one? Like, let's just see if... I've been open for 14 years. I tell parents, I'm a parent serving parents. I'm not an educator. But people are like, you're a nurse, here's my child. Up until this year, I had a 1.5-year wait list. Number one reason I'd shut my doors is because of staffing. I can't find teachers. I'm in the Shriner building. I pay $28,000 for rent. If my director was here, she would be a witness and let you know I don't touch tuition. I don't know what she charges, how much she charges. She doesn't let me touch that. I net about 10 a month. And that's because I have to collect for times of emergency, like COVID, like TK, 25 kids graduating out of the program, right? And so they're like, I don't know the future of my preschool. My biggest problem is staffing. I can't find like qualified teachers to fill the spots. But I always empathize for working parents, and when numbers get low, I tell my director, don't even worry, they're gonna be in sleeping bags. I've had parents come to me, how old is your child? Oh, we're still trying. It should not be like that. Like, you're still trying to have a child and you came for a tour to save your spot?
What is your waiting list?
A year and a half for my infant program.
And do you have any openings now?
Not for the infant program, because also I have 30 spots for infants. I have 103 capacity preschool. It's the families that come with the second babies will also take, precedence. So, yeah. So I had a preschool right next to me and another one to the left of me. There was one behind me, Papillon and Ganon. They all closed at COVID, but I was not worried about it because there was enough kids for all of us. Yeah. So, thank you.
Thank you very much.
Move down to this end.
Good evening. My name is Marcus Alvarez. I'm also the organizer with the International Union of Elevator Constructors, Local 8, representing 1,400 members throughout the state of California and Reno. And the one thing I think about, as well as also I think about my wife when she worked at Kaiser, was the crazy hours that we work and the crazy travel that my members do, where I can be close to home or working in San Francisco, Tom's working for months in San Luis Obispo or Shasta or in Kings County and in Reno, or for our working nurses who can sometimes be doing 12, 14-hour shifts. The one thing we think about is early childcare is something that's always been in my mind. That working a job where you have to be on the job site at 6 in the morning, not a lot of places are open to drop off your kid, especially when two parents could be starting at 6 or 5 in the morning. That's really difficult to do. And not only that, with our folks older, it's hard sometimes even to depend on family close by to do drop-offs, or that one parent has to sacrifice and stay, where I don't want to see that. I love that my wife has her amazing career. I love my career in representing my members. And I would hate to see that's because there's a loss in the you can't drop off your kid, and that you have to make sacrifices or end your careers, because eventually that's what a lot of people I feel sometimes do is they pause their career or end it completely because there's not that availability there. So whenever we're thinking about this, please think about those people too.
Are you familiar with PalCare in Burlingame?
No, ma'am.
So that's a program that was created probably 20 years ago, in part for the airline industry, because they had unusual hours. And so PalCare, I believe, starts the program quite early in the morning and goes quite late into the afternoon, evening. So, what you're, I think, illuminating here is that we don't do a good job of
Advertising.
making sure that our parents know what the options are. But that is a program that's been around for a very long time.
Thank
So,
you.
if you will let us know, we'll put you in contact with them.
Thank you very much. And by the way, Mike Hardiman's son, Greg Hardiman, says hello.
Your story also resonates with me. When I was mayor of East Palo Alto, my daughter had surgery, and my grandson was just maybe a year and a half old. And I couldn't, and the lights were out, the power was out, and I had to go to a city council meeting. I just had to put him in his pajamas, his warm pajamas, and for the first 3 hours, he sat next to me. But after that, he's a young little boy, so he was just running around the council chambers. But I had to do the work, and I couldn't leave him with his mom. So I understand those off hours, thinking about what those off hours look like and how we can have more opportunities in different parts of the county for that help as well.
Hi, my name is Anvi. I am a parent. So I have two daughters, age 8 and 4 now, but I have been part of a family childcare since each of them were 6 months old. So I'm going to speak a little bit about what family childcare is offering to us as parents and even children, and why I feel like why I kind of resonated to having my child over there. Expense is one aspect, so I think we all know about it, but more importantly, coming from a family, I immigrated from here, from India. We had all our family over there. We had neighbors, we had cousins, we had everyone around us. Came over here, had our kids with no family absolutely around us. When I had my child, I had two options just like everybody else. Either I quit my job and stay home with her, or find the right childcare for her. And that is such a right childcare. I say the word right because you want trust. You're sending your child somewhere for 8 hours a day or more probably, and you want to make sure that not only they are taken care of, but they are loved, because they're sending them at 6 months or so. I was drawn towards family childcare primarily for this, because it is a small environment. It is a home environment. You're sending your infants right. I sent both my kids right from 6 months to 5 years of age, primarily because I know not only they are learning, they are taken care of, but it's that home atmosphere that drew me to them. I know for a fact that if my child was being naughty, she's not just thrown in a corner. Because of the small ratio, they were talking to her, they were expressing her, they were letting her express, they were having a conversation to her. All of that is only possible with that small environment, like atmosphere that was there. And as Haley mentioned, home cooked meals and all of that are just it's kind of like a cherry on top. So they are doing so much. I've gotten inside home daycare, and I've seen how a crazy thing is going on. They're taking care of kids. They're making sure that they are safe, they are loved. They are giving them discipline. They are teaching them structure, and they're giving them home cooked meals. It's everything a parent just thinks of doing but is not able to. And I think she has been a part of my parenting journey. We call her the third parent to our children, because otherwise we wouldn't have survived over here. Without no family, without not even a sister over here to come watch our kids for a while. Family childcare gives that. It gives the love, it gives the flexibility. We've been in situations where, we have been late for work, and I didn't have to worry that, they're going to charge me like $25 for 5 minutes being late. She was fine. She was there. She was happy, even just because it's a home at the end of the day. So I think family daycares, home daycares are probably not getting the TLC they need, because we don't realize how much they are providing to families, how much they are giving to us as parents, because not only we are absolutely worry-free, being able to keep our jobs, know that our child is loved. That is the most important word here. They are loved, they are taken care of, and they are learning every single minute of the day.
Thank you.
Good evening, Supervisor Speier and Supervisor Gauthier. My name is Krishna, and I work at the County of San Mateo. I was a single dad for 3 years when my son was born. He has autism. And the biggest challenge for me is when I tried to go out and find a job, the salary that would pay would cover would be less than what it would cost to cover us to my now 18-month-old daughter and 3-year-old son. So I couldn't work because I was forced to be a single dad, for a while. And when I got the job with the county really offered a subsidized daycare, and I really, really appreciated that, even though it's still 60% of my salary goes to county daycare, even after subsidy.
Can you tell us how much you're paying, please?
It's $3,200
For
2 kids,
For 2 kids.
toddler and a 3.5-year-old preschooler. And the biggest challenge is also, how the autism rates are so rampant now among the boys in California and the US, right? So the biggest challenge is also taking them for therapy, like speech therapy, occupational therapy, and all these things. The biggest challenge is actually trying to figure out how I can support my child, work peacefully, and also ensure that one of them is not sick, so that I can show up to work every single day. And I can really empathize with parents that have 2 or more children, because it's very, very hard. You mentioned hand, foot, mouth disease. If one of them have it, then I'm panicking. I'm in my office and I'm worrying about, will my nanny show up, right? There's no on-call nanny. I can't afford an on-call nanny after paying 50 to 60% for childcare, right? So I really appreciate what county does. I really respect Mr. Calgi's administration, and I really love what he does for county employees. But I'm also hoping that at some point, like you mentioned, universal childcare is so important, because people need to be able to afford childcare. They shouldn't worry about whether it's going to be their job or their child. There should never be that question in their mind. So I'm hoping that with, I know we already do certain childcare measures with Measure K funds, like providing childcare centers with renovation efforts and infrastructure improvement and things like that. So I'm really hoping that you can bring this Measure K, to light, so that those funds are exclusively dedicated and clearly accounted for in how they can help parents, and also like these childcare centers that are really struggling. Technically they shouldn't be struggling. And they're also like, since I work for emergency management department, they're also like prepared for emergencies, which during 2022 floods, I don't know if you noticed, but the childcare my son it wasn't prepared at all. The house was like in floods. So there are many childcare centers that don't have that, and they don't even know that we already allocated Measure K funds for infrastructure improvements and emergency preparedness. So I don't know how we can bring this to light, but there needs to be some kind of educational tool for childcare providers to actually put this in the spotlight, and also for parents to know that they can also go and work and exercise their mind, because like they said, like Ambi just said, it takes a village. In India, people will be there to support you, but here I have nobody to support me. It's just either I show up or I don't show up. They're sitting at the child care center. So I truly appreciate what you guys are doing. Thank you.
Thank you.
Hi, I'm Dr. Suzanne Dideau. I'm the Chief Program Officer at JobTrain.
Hello, I'm Elise DeRozier. I'm the founder and executive director of the Institute for Families and Nannies. Of Families and Nannies, that's right.
Mm-hmm. So we wanted to speak to two major issues. I mean, there's so many we can address, but two that I just really wanted to highlight. JobTrain provides, among other services, workforce development for free to individuals throughout San Mateo County. Last year, 47% of our participants had at least one child in the household. In addition, when we did a focus group of individuals who had to drop from our free, one of the few places that you get free workforce development, career training, 6 out of 8 women said one of the reasons was due to childcare. So here's an opportunity to get free training to become a medical assistant, a CNA, get into carpentry, building maintenance, HVAC, IT, and go on a career trajectory so that you can start bringing in good income into your home. And you can't even start because you don't have childcare. So with that said, one of the things that's really important to us is we're hoping to figure out ways to subsidize childcare for individuals in our training, as well as when they graduate, because let's take a medical assistant. Starting off, what shift are they gonna have? Graveyard. What are they gonna do if they're a single parent and they need childcare? And so this is one of the reasons that we're in partnership with Tiffin.
Thank you, Suzanne. So I'm speaking on behalf of the families that are not able to find an opening in licensed childcare for those families, and it does comprise the vast majority of parents with infants and toddlers. For these parents, they have very little recourse. For those that are very fortunate to have women or mothers like you, grandparents, next door neighbors, or aunties that are able to provide care for them, they're the fortunate ones. However, many do not, and they are forced to enter into a market of unlicensed childcare. These are the nannies that are out there providing care for infants and toddlers. These women do not have any requirements or expectations. Anybody can say that they want to take care of children, put an ad on care.com, Urban Sitter, on a Facebook mothers group, that they'll provide care. They do not have our need to have a resume, to have references, to have background checks, to have any of their vaccinations, a TB test, or a CPR and first aid training. We should change that. We should, in order to build the supply, particularly because they provide not only care for infants and toddlers, for families who are unable to find an opening in licensed care, but also because they're the ones that work for families who do have to work unusual hours. Those that are working graveyard shifts, those in the hospital, those at the airport, those who are working construction sites that have to work unusual and also flexible changing hours. Nannies do that, as well as those who are grandparents and aunties who are taking care of children in their family, who are out there looking to supplement their income and work for the children, caring for the children for other families that need care, evenings, weekends, nights. So I'm here to suggest and to really encourage you to be thinking beyond just licensed childcare, to be elevating the expectations and elevating this segment of the workforce who is out there providing care to ensure that parents have quality care. We also have to really, really think about what it is like for a parent who is on maternity leave, who needs to find care, and that time goes by all too quickly, to have to go and to be into an open market, to be looking for someone who is a stranger to her, and to be really hiring somebody sight unseen and leaving her 3-month-old baby with somebody that she met online a week before or the day before, and leaving that baby with her for what can be up to 10 hours a day, 5 days a week. So again, I encourage you to be thinking beyond just license and building that supply, to be elevating and supporting quality care with those who are working unusual hours and unlicensed.
So there used to be a program called Trustline where families could access information about someone they were considering to care for their child. I presume it still exists.
Absolutely it does, and they do provide a background check for home child care providers, in-home child care providers. That does exist, but, and I say but, because it's one of many other pieces that parents need to know about the person who is taking care of their baby unattended at home, in order to have at least a basic level of trust that their child is in safe, good care.
I appreciate that, and I appreciate the work that Job Train is doing. What I would like to see and consider for even Job Train or training programs like Job Train, is there an opportunity to provide a daycare on site for those who are going through training? They're receiving free training, but imagine if you brought your child with you, you're right in the same building, and it makes it much easier. So I know at some point you're thinking about building a new building. It would be good to think about adding a child care to that facility as well.
We do have one preschool for ages 3 to 5, but it's traditional hours, right? And unfortunately, it's not infants. Infant care is more expensive. We had it at one time, but it just wasn't able to be continued. And also, we have people coming from all over San Mateo County, as well as other regions, but for tonight, we're talking about San Mateo County. And beyond infant care, for example, these challenges of the off hours, and that's why we're really trying to think of what we can do to expand it. We do want to actually expand another classroom as a part of our building of the new building, in hopes of being able to get some of those slots at the primary school so the community doesn't lose those slots.
You know, there's also a program through the county. It's a loan guarantee fund, a housing loan guarantee fund. And we're talking about setting aside up to $5 million to be able to use for construction. And if we do that, those loans can be forgiven over the course of 20 years. So it's something else that may be available as you're thinking down the road. But I would also hope that since your clients are low income, that they're eligible for subsidized childcare. And why don't we have some conduit between the county and your program to make sure they get qualified for subsidized childcare?
Absolutely, and many of them do qualify for the subsidized childcare, but then it gets into the issue of connecting, and we have great work that we're doing with the Ravenswood School District and navigation to help find those spots, and it's showing to be an effective strategy, which is great. But then also just once again, the subsidized care is often during hours that may not be conducive to some of the individuals. It definitely helps some of our families, but not all of our families. But it's very important. I would love for more of those opportunities for the people who participate in our programs.
Hi, my name is Lori DiMartini, and I'm a small family child care provider in Belmont for the last 36 years. And with my experience, I have found most parents with infants want their infant in a small home-like setting. We can build all these big, huge centers with lots of infant spaces, but they want like 2 or 3 children that are going to grow up with their children. They don't want hundreds of children and lots of germs going around. They want a small, intimate setting that would be more like if they were a stay-at-home mom. And the thing with family childcare is we can pivot. I'm there, I live there. I can open my doors early for a parent who has a flight to catch early in the morning or who has a late evening flight. I was open during Loma Prieta. I had a client who was working in San Jose and 280 was closed and he couldn't get to my house. So we sat the little girl down and she ate dinner with us. And her dad rolled in about 7:45 and he sat down and had dinner with us too because he hadn't eaten all day and he couldn't get home. So family childcare is really essential as far as being able to pivot and being able to really address the needs of children. But the problem is that I am small. I can only take 6 kids. And licensing says that infants are considered from 0 to 2. Well, now with TK, a lot of preschools have to pivot and open up their doors to 2-year-olds. So my 2-year-olds, once they turn 2, they're going off to preschool and they're leaving, which leaves me with only 3 spots available. I don't make a profit until I have 4.5 children in my care. So I last year did not make a profit. I'm probably not going to make a profit this year. And if I don't make a profit next year, the IRS is going to say, go find another different job because you're not going to make it in this business.
So the Child Care Partnership Council has been working with family daycare providers, and at the last meeting, many of them had openings that were just not being filled. Is that your situation?
Yes, because they can't find us.
They can't find you.
The My Child Care plan, from what I'm hearing from clients, is very difficult to navigate. And a lot of parents of infants especially depend on word of mouth. So you need to have friends and neighbors who are willing to shout your praises so that you can find children. I'm in a little residential town of Belmont that doesn't have, big industries or anything around it. And my clientele is now growing out. So unless my current clients, I only have 2 right now, really shout my praises, I'm probably not going to get word of mouth out there. So I think we have a lot of problems to address. We need to fix the My Child Care plan to help parents find care that's available. And offered not just a child care spot in a big, huge program, but also small family child care. But I'm lucky. I've lived in my house 36 years. My mortgage is probably less than most people's rent in this room. And that's the only reason that it has made me be able to keep my doors open. And also I'm married, so I have my husband's income also. A lot of childcare providers are single, and they have to rent. And landlords typically do not want to rent to anyone doing business out of their home.
They legally can't do that.
You're right, but guess what? They still do. They say, oh, we're going to move into the house now. Or, they say things because they know legally they can't, but talk to a lot of childcare providers, and it's happening still to this day, that they can't find a home.
That's a good lawsuit to bring.
Yeah, it is. Actually, it is. Thank you.
Can we hear from some parents?
Hello, my name is Julia Wrigley, and I am a mother of 20-month-olds, I'm a working mom, and my husband is a working father, and we are struggling with childcare. We currently are at a family in-home daycare, which is amazing, and I'm so grateful to those that do that because it is a lifesaver. I can text her and say, I'm running late at work, can I leave? Can I stay with them for a little bit longer? And she'll say, that's fine, keep them here. Or if I need to drop them off earlier, she'll open the doors. But what we will run into is daycares and preschools don't always have that opportunity. They open at 8, they close at 5, and that's my hours. My husband starts earlier, gets off earlier, but sometimes work goes longer. We're also struggling with wait lists and being on the wait list. And when you have twins, I think it's a bit of a scarier choice. People don't always have 2 spots open. They say, oh, I can take 1. I can't separate my babies. They're a combo. We're a package. So I think as a mother and a working mom, I had to go part-time because childcare is so expensive, and I'm a medical assistant. And I'm so grateful for my boss and my work. I recently had hand, foot, and mouth spread in from daycare, and I had to take time off to be home with my babies. And my work is very able to let me do that, and they're very understanding. But not all women or fathers have that opportunity. My husband started a new job this year with Local 39, and he can't take time off. So I think as a mother I live in Pacifica, it's a struggle. It's very competitive to get into daycare. It's very competitive. It's more of like a network, like who do I know? How can I put my name in there and help boost myself to get in? It's like an interview. And I think we need more help. We need more funding. We need more teachers. We need more amazing people that want to do this every day and take care of our babies and love them like we love them and teach them amazing things. So
thank you for sharing that.
Thank you.
Good evening, Supervisors. My name is Liz Scully. I'm the Executive Director of the San Mateo County Family Child Care Organization, representing our lovely family child care providers in San Mateo County. So a little bit about me. I've been in the ECE field here in San Mateo County since 1998. I've been a center teacher. I worked in Head Start. I was a nanny for several years. And for 17 years, I ran a licensed family child care out of my home that my family owned in Burlingame. Up until 2 years ago, where I closed due to staffing challenges and other regulatory challenges that our field that is placed on family child care, particularly an 80-20 regulation that requires us family child care providers to be present in our home 80% of our operating hours, leaving it extremely challenging for us to go to doctor's appointments, to go to our own families' school events. I had a parent and a grandparent that were both on hospice at the same time, and so I was just not able to kind of work that. But really what I want to address today is the current realities that our family child care community is facing on the field. I know that we're in this space and we've talked a lot about wait lists and not enough spaces for children in our community, but I think that one of the challenges that we have is that parents don't know family child care exists. They don't know we're out there. Since 2017, we've lost 24% of our licensed family child care providers in San Mateo County. That's over 150 of us. When I go to child care fairs, when I go to preschool fairs, and parents come to our table and they ask us about our organization, we tell them who we are and we explain to them we have over 450 licensed family child care providers in San Mateo County, all operating independently of each other, and they're all independent business owners. And here's the value of family child care. And the parents say, oh wow, they didn't know. They know their centers, they know there's nannies, but they don't know there are family child care providers, they don't know the importance of us, and they don't know they might have a family child care provider living right down the street. That can offer these type of flexible schedules, extended hours. We know that the majority of parents want their infants and toddlers in family child care homes. Yet we're sitting here saying we need more spaces. I have plenty of family child care providers who live in Priority 1 zip codes, Daly City, San Bruno, East Palo Alto, who have openings, plenty of openings, 8 openings, 4 openings. They're not able to connect with the families. And so I think that while it's important to have more providers and programs coming in to San Mateo County, I think it's really more important to shore up the current providers that we have here and investing in them before we start investing in more providers coming in. The other thing that I want to address is the subsidy rates. I think that we live in an extremely high cost of living county, one of the highest in the state, and yet our subsidy rates don't provide a cost of living. So for an infant, the state pays me $1,600 approximately per month to care for that infant. And then they cap me at telling me I can care for 4 of them. I can't pay my rent at $1,600 times 4. I can't hire a teacher. I can't do all of the other things that I want to do. And so while we can talk about there not being enough spaces, I think we need to figure out how we're filling in that gap, right? San Francisco is doing it, Alameda is doing it, and we need to figure out how we can do that here too.
So in both Alameda and San Francisco, they have had sales tax that were dedicated for childcare. So
Right.
Think about that. I mean, that's something I would really like to see us consider moving forward, because it would really relieve some of these issues. Now, in fairness, some parents, it's a parent's choice.
It is.
So a parent gets to choose whether they want a center-based experience for their child or a family daycare home. But the real issue, it appears, is that we don't have a comprehensive list of all the providers. And that's one of the things that we want to create, is a portal that will have every child care provider in the county, and that parents can access that.
Yeah, I think that that's one of the topics that we talk about as family child care providers, is connecting with families and figuring out best ways to do that. We've created a Facebook group, San Mateo County Child Care Connection, that aims at doing just that, connecting with parents and providers in real time. These providers can create flyers, they can advertise on this Facebook group. Parents can go on this Facebook group and say, hey, I'm looking for care in 6 months in South San Francisco. These are what I'm looking for. And providers who have openings will respond. I think that we have to look at different ways to connecting with parents, right? One way is not always going to be the best way. We should have many portals of coming in to connecting with them. So, thank you.
Hi, I'm Karen Hasfaletta, the founder and director of Footsteps Childcare. We're a nonprofit in San Mateo, Belmont, Redwood Shores, and Redwood City. We've got 2 infant toddler preschools, a preschool, and 4 school-age programs, and one that serves over 220 children each day. And it was the first day of school today. Yay! I'm very tired. So I just want to say, thank you for doing this. I love hearing the parent voices. I love hearing the family child care voices, because we're all in this together. So I represent centers, and I think it is crazy, Liz, that the state pays family child care so much less than they pay center providers, and that's wrong. But I also think that we're having problems with centers. So she's talking about all of her openings. Well, we have openings. I have openings in a beautiful brand new center in downtown Redwood City for infants, and I can't fill them. So, and I've put it out, the networks and everything, they're all, parents are most likely wanting them after a year, which is great. Maybe parents are wanting to stay home with their children longer, I'm not. But we have a disconnect. And then I have another center that's completely full and has a very long wait list in Belmont for infants. So it depends on where you are. I think there's places there's been too many centers built, and other places that are still a childcare desert. And we have to look at the balance of it all. I'm also on the board of directors of the 4 Cs, and I feel very strongly that there is a network out there for parents to look for where they're to find childcare, but it's not one that parents know about. So we need to strengthen that. We need to make it much easier for parents. And then I'm all for the sales tax. I believe that we're only way we're going to save our industry and make it right for parents and providers and do a living wage for our teachers and child care providers is to have subsidy. And whether it's a subsidy from sales tax in combination with businesses or whatever combination we need to do, we need to change our system because it's not fair to parents, it's not fair to providers, and it's not working. I've been in this for many, many years. I'm a grandmother, and it's just very hard for families right now, and we need to fix that. And I thank you both because I know you're going to do that, and I'm going to dedicate my time after I retire to make sure it works and it happens, but we need to fix our system, and we need to fix it yesterday. Okay, thank you.
Good evening. My name is Hector Camacho, and I wasn't intending to talk. I'm at the County Office of Education, but I felt that I should speak up because one of the things that we don't talk about as much is the emotional impact that this has on families when they enter this situation. As I'm hearing the stories of both the providers, but more so of the parents, I'm thinking of my wife who's sitting back there, and it's making me a little emotional myself. And what she went through when we had our first kids, because I was a classroom teacher, she's a federal employee. And when we had our first kids, it's hard to find someone that, as was said, that you want to trust your babies with. They're your babies, and we were new parents. And my parents were still working. They couldn't help us out. They wanted to desperately, but they still were working. And on 2 government salaries, just the childcare was not affordable for us. And so I bring that up because even this conversation like almost needs a trigger warning, right? It's like you're gonna hear stories about true like anguish of what do I do with my child. As a classroom teacher, I was given 2 days off when my first son was born, and that's what we afford in this state, right? 2 days off for a child being born. So I think about, as we're having this conversation, how do we have it in a way that's even earlier, right? We're talking about, one of the providers talked about parents entering the wait list while they're trying still, but those conversations, we know families that are expecting, and how are we preparing them for that mental separation that's gonna happen when their child is born, and this dilemma they're gonna have to face in even finding that care. So just more of a trauma-informed approach about how we even talk about childcare needs for both parents that are facing that challenge right now, but also expectant parents, because many of us are all parents, and we never knew what we were getting into until that moment we saw that child in our arms. And I can remember that moment vividly. But we can talk about this more openly and talk about we are doing everything we can to try and find that care because our families deserve that. So thank you.
Thank you. Okay, it is almost 7:30. Is there one last burning question that anyone wants to ask or a comment anyone wants to make? Okay.
Hello, my name is Guadalupe. I am a public health nurse and I work with Nurse Family Partnership. I work mainly with Spanish-speaking moms in Redwood City and East Palo Alto. I think I'm probably going to be repeating some of what points other people have made, but also a few others. 4Cs is a great program where they help with subsidized childcare. However, some families are on the wait list for a really, really long time. I've worked with San Mateo County for, I think, a little over 11 years, and I think probably my first 9 years, I never had a family actually make it to the point where during the time that I'm working with them, that they actually made it to receiving some kind of help from 4Cs. So the wait list can be really, really long.
So what happens to those families in that kind of situation?
And so in those situations, they are leaving them with neighbors. They're not entering the workforce. They are having to really, really struggle to find ways to make it work. So they figure it out. I think that family childcares are, like, I know that for me, for my child, family childcare was what I wanted. But being able to, if they are not connected to 4Cs, how else they can find the family daycares that are within the community, hopefully people and faces that they can trust. But I think also if I can suggest other options where with 4Cs, they have the subsidized funding to either go to a center or to a daycare, but social media can be a great thing and a tool for education, but could also really scare families. And I have a lot of families that don't want to put their children in daycare because they're afraid their child's going to be abused, or all of these things that you see in social media. And so when I'm in the home, I do my best to, those are sensationalized, and you're seeing videos that are happening in other countries, and you don't know what's behind the story of that, right? So I do my best to try to dispel that. But they may have a family member that would be willing to care for the child if only they could help pay some, so being able to, through 4Cs or other programs like that, being able to pay people that they know and they trust directly rather than a home daycare or a child care center. And I think along those lines, also creating some kind of community outreach, so that even though these stories are going out in social media, that, hey, family childcares are places that you can trust. Daycare centers are places that you can trust. So some sort of community outreach, so that, the families don't have that in the back of their heads. They can, feel a calmness and tranquility when they are making those decisions. I, for many, many years, was working with adult families. I was working with the prenatal to 3 program, moms that were in their 30s. And recently now in Nurse Family Partnership, I've been having more teen clients. And so as I've been transitioning into being a teen provider and working with teen moms, one of the things that I'm realizing as the teen pregnancy rate was dropping, a lot of those services were being kind of taken away. A lot of those resources to teen parents were being taken away. And so right now, when the teen moms are trying to return to school, they don't have the childcare resources. No on-site childcare, very limited spaces for on-site childcare and things like that. So I think if there can be some, just kind of a little bit more attention to the teen moms that are trying to return to school. And then also that additional support for working outside, like for childcare being provided outside of the normal business hours, just because we have a lot of single moms that maybe not have transportation. They're working odd jobs, they're working weekend jobs and things like that, where they can't function within that those business hours. Thank you.
Just want to thank you for coming. Your stories are so important, and they're going to help us as we continue to look for the solution. We know that there is a solution. And again, please stay tuned. We are going to have 2 more listening sessions. So spread the word, because we need to hear from others as well. Thank you.